Okay, so here we go, older adults. I had a little break in the PowerPoint there, and I don't know what I did, so might have to put this up separately. 4 key guidelines for older adults. There are, um, they apply, same things that apply to adults apply to older adults, but 4 additional qualifying guidelines is that, if there's an adult who cannot do 150 minutes per week, anything is better than nothing. And then we want to incorporate balance exercises for old adults. Going back to fall prevention, this is not a recommendation for children or normal healthy adults, but it is a recommendation with regard to balance for older adults, 65 or older. Also, we're going to use relative intensity, not absolute intensity, to determine effort. And we need to assess chronic conditions and injury risk for each individual before encouraging them to exercise. So let's go to that first one. When older adults can't do 150 minutes of moderate intensity activity because of chronic conditions, respiratory conditions, sedentary lifestyles, then they should be physically active as their ability allows. So if physical activity is beneficial and can help affect functional limitation in adults, adults with limitations don't need to be inactive. That is obviously going to increase their risk for morbidity and mortality, but they should be as active as they can be. And this really applies to those over the age of 65, but it can also apply, as we said earlier, something's better than nothing, to those that are under the age of 65 with low levels of fitness. And we would say that biologically, somebody who's sedentary can have a biological age of 65, even though their chronological age is, 45. So think about that. I mean, we're just saying the same thing that we said for an adult who couldn't meet the minimum guidelines is do something. It's better than nothing, and work your way up if possible. With older adults, sometimes that overload principle will not work. Just try to maintain whatever level of physical activity they can maintain. Also, older adults should do exercises that help them maintain or improve balance. There is insufficient evidence maybe to say this for all older adults, but research studies have really indicated that sometimes using exercises for to get to their minimum levels that actually help their balance is great. But balance training really is indicated for those that are at risk for falls. And many of our 65 plus individuals are at risk for fall. And this can be a great fall prevention strategy and can increase their lifespan simply by preventing a fall. I want to go back again that these recommendations were all for health benefits, but there's more beyond just health benefits. There's more health benefit. There's fitness, being more fit cardiovascularly, muscular strength, muscular endurance, body composition, flexibility can all be better than what they are. That's fitness. But really, if you think about how we go through that continuum, we all should be on the road of moving forward on the continuum towards wellness. And reducing our disease risk is a great first step, but doesn't have to stop there. We might want to optimize our physiological function. And is this just a health benefit? Is this fitness or is this wellness? You have to talk to that point and should be able to, by this point in class, I call it wellness, and it's what I really wish to promote. However, you have to start where you are and you have to work progressively. You have to progressively overload, otherwise you risk injury. And that progression will reduce that risk of injury and enhance your ability to be successful as you move forward on this road to wellness. Lastly, I want to talk about this slide, which I put together because you're going to be creating some sort of a physical activity program for yourself. Now, this starts with the minimum recommendations, right? But then when you get into the adult population, It talks about whether you're inactive. If you're inactive, meeting those minimums is probably like the maximum that you can do, right? You might need to start with 60 minutes per week and move towards 150 minutes per week if you're sedentary, right? And you might want to start with light intensity activities and then start putting in moderate intensity activities. Think about this concept that you read about in chapter 4 of progressive overload. Don't jump into something that you're not ready for. It needs to make sense, and I mean by that good common sense with regard to the principles you've been reading. Now, if you're already active and you're at 150 minutes per week, you want to progress towards 300 minutes per week, either of moderate intensity or 150 minutes per week of vigorous intensity of some combination therein. If you're already highly active, maybe you're an athlete and you're participating in a sport and you want to increase your physical activity, you're going to follow this highly active guideline. Adults 1864, we have the same thing. We have inactive adults. We want to move them to 150 minutes of activity, but we may have to start at light activities. And for them, notice instead of using METs, that absolute measure, we use relative measures as a rating of perceived exertion. And what I've listed here is a 1 to 10 scale. 1, you're doing nothing, but you are awake, and 10, you're falling out. And we're really not putting them past a 6 on that scale. We are going to include muscular strength training for all of these groups. You might be starting with 1 session per week and then trying to get them to something greater than 1, which would meet the minimum recommendations of at least 2 per week, right? And then you might want to go further, and you might want to exercise more. Again, all your recommendations are listed here. We include flexibility for adults and older adults. We also include bone strengthening activities for younger children, as well as muscular strength activities, but we don't make recommendations as with regard to intensity or frequency or repetitions, right? And for active adults, we include balance activities on 3 or more days per week. It could be something like Tai Chi that they do for exercise, but they also incorporates balance training. It's all about static muscle contractions or holding positions that actually work your core to moving your limbs around in circular motions, but you're balancing. Basically, you're figuring out how to balance your center of gravity as you do those movements around your core. So you can use this. This chart is a great place to go for your physical activity challenge paper. And I do want to say that I am going to ask you to be physically active for 1 or 2 weeks, more so than you are, to incorporate some physical activity you didn't usually do for a week or 2 and reflect on that. I look forward to seeing your papers, and I also look forward to hearing what you guys are looking forward to doing with your physical activity and your wellness.